We've been working with our care home partners for a long time with our education and our training for them. In the last couple of weeks, though, we've had to change that because of the COVID situation. And how I mean by change is two things. One is there's some need for some urgent training, so there's more training to be delivered to their care home staff, and also how we do it. So you can see at the moment that I'm sat here in front of my computer. Normally we would go out. We'd go out and meet the staff, do the teaching face to face. But at the moment we can't do that. We have to keep our care home staff safe. So I teach via Zoom now. So I have my presentation on the screen and my camera here. This enables us to allow staff from any care home to zoom in. So it's around their availability, what's going on for them. It's a very different way of doing it, but it's actually been very successful. The main focus of our training right now is verification of expected death. So this is something that we have already trained some care homes in. So now we're doing refresher training or new training for homes that haven't undertaken this skill before. The reason we're doing this is we're trying to reduce the footfall down into care homes. So GPs are not going in as much as they used to. A lot of it is telephone. We're not going in as much. It's all by telephone. So we're trying to enable the staff to care for their residents right the way through from the moment they come in, right the way through to the end, which they do beautifully. And this is just the final bit. But in the next few weeks, we're also looking at some symptom control and some other things. So we've gone out with what would they like? What would they like us to train them on? The main service we've been really pushing and reminding them about has been our telephone support line that is open 24 hours a day, 7 days a week. And that is absolutely available. It can be quite lonely out there if you're the only nurse or carer on and you don't know what to do. They can phone in. And we know that they're starting to use that service more, which is just great because it is about partnering at the moment and us supporting them. They also have access to our medical team advice if they want medical team. So the GPs may also phone in who've got residents that they're worried about. They can talk to our doctors. If and only if we feel a visit is absolutely vital, we will also go out and see a resident. And that's about reducing the footfall into the home. So we're trying to avoid visits if we can to keep them safe, but if we have to, but of course our staff wear full PPE when we go in so that we keep them as safe as possible. So we don't visit as much as maybe we would normally, but a lot of telephone advice. We do also have our inpatient unit that if they were really stuck, we are still taking patients